says Ariana Jensen, scenario 4, IV direct medication of morphine into a intermittent infusion device. So I've just come back from assessing my patient. She is in a lot of pain. She's saying her pain is an 8 out of 10 on the pain scale, and it is all over her body. So I'm going to go and I'm going to check my orders, see what I can give her. So she has an order for morphine, 2 milligrams IV every 1 hour, PRN for pain. And she has not had one in the last little bit here, so I'm going to check my orders. So I've got 2 milligram IV every 1 hour for pain, and it's supplied in a morphine 10 milligram per mil ampule, and the IV drug monograph says to dilute to concentration of 1 milligram per mil. So I have done my math here, so I'm going to want 10 mils of total volume in the syringe, and 1 mil of that volume is going to be the medication, which I've drawn up from the ampule. 10 mil total volume, so the 10 mil minus the 1 mil means I'm going to be diluting with 9 mils of normal saline. So part 3, figuring out how much is going to be for the 2 milligram dose. So to get the 2 milligram dose, I'm going to want to give 2 mils of this dose to achieve that. So then now I have to figure out how much I'm going to waste. So for the 10 mils total and 2 mils of my dose, that means I'm going to have 8 mils of wastage. So now it's important to look at your monograph, because I have to see how fast I need to give this over. So for a direct IV, undiluted into running IV or diluted into normal saline, maximum rate of 2 milligrams per minute. So if I'm giving a 2 milligram dose and the max rate is 2 milligrams per minute, I'm going to want to give this over 1 minute. Okay, there's all my math done. And of course, I've assessed her pain, and we know her respiratory rate, her heart rate, and her blood pressure and sedation scale are all within normal ranges. Okay, so now I'm going to get it out. So I need another nurse with me because this is a narcotic. So I have my lovely nurse, Sarah, here with me. So we're going to take it out of the narcotic drawer. We're going to pretend this is the narcotic drawer. So now we need to look at our narc count. All right, so it says we should have 1 of the morphine 10 milligram per mil amps. So now I'm going to fill this out. So it is going to be time. We are looking at 10:36 on September 29th for Evelyn Smith. So there's not much room to write in here. And then her doctor is Dr. Russell. And then I'm going to open my drawer and then confirm, yes, I have 1 morphine 10 milligram per mil. Sarah's going to be with me seeing this. We've got 1 10 milligram per mil. So I'm going to have this. And then the dose, I'm taking out entire 10 milligram per mil for a 2 milligram dose. Okay. So then I'm going to sign here. And then Sarah is going to initial with me saying that that is done. This is the 10 milligram dose, or 10 milligram ampule, and we're going to get our correct dose out of there. Now that our NARC count is balanced and correct, I'm going to take out the rest of what we need. So I need something to dilute with. I need something to mix with. And this would all be sterile and sterile packaging. I've got my little mixer doohickey. I need to get a med label out. And I've got my blunt syringe. And then I also need a couple flushes to bring to the bedside with me to make sure that everything is going to be flushed appropriately and checking the patency of the IV. Okay, so first things first, hand hygiene. All the morphine out of the top here. break it off. So since when I took it out, I made sure I matched. So morphine, so my math, I know I'm going to be taking out the entire thing to dilute it. And it's for Evelyn Smith, and it's for pain, and it's going to be given now. And there's my documentation, every 1 hour, IV, and morphine. So I've got that ready. Now I'm going to want to withdraw it from here using a blunt fill needle to make sure that we're keeping everything shard free. So Sarah will still be with me because she has to clarify I've taken all the morphine out of my little ampule here. So I'm getting this in. All right, Sarah, let me just quickly get the bubbles out. So Sarah, I've taken out my entire 1 ml from this dose. You can see right here, it's all in there. And then now I'm going to waste this little vial here, or this little ampule. Okay, so but before I waste it, I'm going to do my second check. So I know I've got my entire little dose of morphine that I'm going to be diluting here to get the correct dose. And so it's morphine 10 milligrams, morphine. It's going to be given IV every 1 hour for pain. Hasn't been given yet. Here's my documentation, and it's going to be for Evelyn Smith. Okay, so I'm wasting that now. And Sarah would watch me waste the vial. Okay, so now I need to be properly diluting this. So I need to attach it to this little guy. So I wanted to add 9 mils of normal saline. So now I'm going to be instilling 9 mils of normal saline to get a total syringe volume of 10 mils. And I've got my 10 mil syringe volume here. So now I'm going to be wasting that last mil. I need to make sure I make my med label. For Smith, Evelyn in 206A. Morphine 2 milligrams. And then there is going to be 2 mils. And that's going down right here, and it's added by me, and then today is September 29th, 17, and it's going to be given at 10:45. Okay, so now I'm going to be attaching that onto my syringe, making sure. Okay, so now I need to make sure I'm getting my 2 mils of the dose. I cannot bring the whole thing to the bedside. Not best practice. Okay, so I'm going to get the syringe. To 2 mils, and then I'm going to grab Sarah again for a second. Sarah, this is my 2 mil dose. Here's the math, here's the order. And then I'm going to be wasting these 8 mils here.
Yep.
All right. So I'm going to show you right now that I'm going to waste it. So the entire thing is going in here. And that's also sharps. Okay, perfect. So now I'm going to get a sterile syringe or needle to just put on top here to make sure that that is going to be safe. So now my final check. So this is for Evelyn Smith. It's morphine, It's going to be 2 milligrams, which is 2 mils according to my math, given every 1 hour IV as needed for pain. She hasn't had a dose yet. Evelyn Smith, no known allergies. Again, checking my monograph to make sure, since it's direct IV, we're going to be giving it 2 milligrams per minute. My math has worked that out to be 1 minute. I've got flushes in my pocket, alcohol swabs, and gloves. So I'm going to write my dose down here, 2 milligrams, and then the time is going to be 10:45, and then September 29th, 17, and then I'm going to dot that. Take this with me to the bedside. Okay, so now we're going into the bedside. Hello there, can you please tell me your name? She will say my name is Evelyn Smith. And then I'm going to just check. Can you tell me your date of birth here? And she'll say my date of birth is April 15th, 1941. Wonderful. And then I'm checking her personal health number to make sure it matches. And then she has no known allergies, which is good. So I'm going to be giving you some morphine, Evelyn. It's going to help you with your pain. I just have to check a couple things first. Evelyn, do you mind if I just lay this watch right here so I can check, make sure I'm giving it over the right amount of time? And she'll say, of course. Okay, so the first thing I need to do is check the patency of her IV, because it's not a running IV right now. So I'm going to swab both ports for 30 seconds. I'm not doing it for 30 seconds in this case, due to time's sake. And then make sure I've got my posi flush and its seal has been broken. So I'm going to insert this here and make sure this is unclamped. I'm also assessing for signs and symptoms of infiltration, so any edema at the site, any coolness and swelling, any pain at the site. Saying no pain. So that's perfect. So I'm going to aspirate back a little bit, and I'm getting blood return, which is good. So now I'm just going to flush it a little bit. So I'm going to instill a little bit. It goes in well, no swelling is occurring, and then I'm going to push, 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 and then that is all good. This is patent. So now I want to attach my morphine. First, actually, I want to re-swab the site, or this, the port. So again, for 30 seconds. So now I'm going to attach my morphine. So I know from my calculation in the monograph, I want to be giving this over 1 minute. So I'm just going to check that right now. All right, so starting now. So Evelyn, this should be working pretty much immediately for you. All right, that's over 1 minute. Now I need to flush the port again with another ml of saline over 1 minute, cleaning for 30 seconds. Making sure the seal is broken. Touched a little bit there, so I would clean again for 30 seconds. Okay, so I'm going to give 1 ml over 30 seconds now. Or sorry, 1 ml over 1 minute. All right, so now I'm just going to clamp it under positive pressure. So we're going to do a little bit, and then half a mil, and then clamp. Okay, that's all good. Take that, clean up my area a little bit. All right, she's feeling good. And then for proper assessment, I'm going to make sure that she's experiencing no sedation from this. So since it does work pretty much immediately, I'm counting her respiratory rate, and that's all good. And then I would grab my vital equipment and then take her vital signs again. And then I need to make sure I sign my MAR. So I left my pen over there, but I would have another pen in my pocket, and I would sign my MAR. And then we're done.